All right. So welcome everybody to the second workshop in our Diving into COVID Data series. I will say I'm particularly excited about this second one because the topic, engaging with data providers, is something that I personally am less familiar with and have been pretty nervous about in the past year. It can be kind of intimidating to just like email someone who is at a state public health department or some other official and be like, hey, I want to know this thing about your data. So I'm really looking forward to hearing our speakers kind of talk about their experiences in that area, share some tips on all of that good stuff. So just a few housekeeping things. We are recording, as you just saw, I started that a minute ago. If you don't want to appear in the recording, you can turn off your video, and also please just stay on mute unless you have a question. And then you can send your questions in the chat. We're gonna do the 3 presentations right in the row and then a Q&A at the end. But if you have any like burning question about something specific during one of the talks, you can also just put it in there and we'll get to questions as we can. And then since this series was funded by the National Association of Science Writers, I'm kind of borrowing their code of conduct for meetings for these workshops. I just put the link to it in the chat as well, so anyone who's curious can take a look. But the TLDR is really just to be respectful, communicate thoughtfully. If you have a question, make sure that it's a nicely phrased question. It's not a mean question or anything like that. And avoid invading anyone's privacy, since, as I said, we are recording this so that I'll be able to share it with folks who can't make it at this time. And then, does anybody have any logistical questions just before we get started? Sweet. All right, Liz, go ahead. Oh, I think you need to unmute
Let
yourself.
me unmute myself. Thank you so much, Betsy, for organizing this, and I'm excited to hear from everyone, including my fellow panelists. But I'm just going to talk a bit about some of my work and then give some ideas and use that as an example. So if you could go to the first slide, or the next slide, I guess. Yeah, so a bit of a backstory. I've been covering COVID since March, roughly. In March, I was like, maybe I should report on the pandemic, and my editors were like, yes. So, and in the middle of the summer, I obtained from a source some reports that the White House was preparing through the White House Coronavirus Task Force and sending out to governors, but not publishing. And the reports offered some detailed data on state to state and metro areas, county, that kind of thing, about the pandemic, and also provided recommendations for different jurisdictions and what they should do. So this got picked up a lot of places. It was a big deal. And despite multiple weeks of me asking the White House, why aren't these public? They were never made public for a while. So then the following weeks, next slide, I started to collect these reports from all sorts of different sources across the country and put them in one document cloud project so that local reporters could take them and use them and write about them. And they're still there if you would like to go back and look at kind of historical data for your area. You're more than welcome to. Next slide, please. But the good news is they're now public. So in December, the White House Task Force finally made public the underlying data in the reports, which is the second link there, the community profile reports. And I'll talk about those more because I think they're a fantastic resource that are really getting underutilized by journalists and people looking at the pandemic. And then also the actual just PDF reports that I was collecting for states are now under the Biden administration public at that link. And they no longer have the recommendations in them for what states should do, but they do have just the same format. So it's easy to compare across weeks and are really easily digestible by people for just kind of getting a handle on where the status of the pandemic as of now. Next slide, please. So when you're looking for government data about the coronavirus or anything really, just kind of think through, I think, different points of where you could get it. So obviously there's whoever's collecting the data and or should be collecting it. You can ask yourself that question too. I've sometimes, if one state is collecting a certain thing about, for example, restaurant outbreaks or that kind of thing, I've taken a link to that data and gone to another state and said, hey, do you guys collect data in the same way? Like, do you have something comparable here? Just thinking through like who should be doing that job and asking about it. Who uses it? Maybe the agency that collects it isn't the one who uses it, and another agency might have it as well, or just who gets CC'd on the email with it, like who has access to it, who could also share it with you. And then another thing that I think is journalists are kind of wary of doing, because if someone else has published it before or done something with it before, then we don't want to. But really, there's some really great data sets out there, and especially in the health space, that people have like written maybe 1 or 2 stories, but they have hundreds of stories in them. And so that can be helpful to kind of look and see, hey, I wanted to write about hospitalization, whatever. Looks like someone else already did, but this is interesting that they were able to get it this way, and maybe I could do it that way too, and then write something else about it. So also, if you can't get the exact data you want, think about other aspects of the situation that maybe would be illuminated by other data sets. So maybe you can't get the exact hospital financial data that you want in your local area, but maybe there are bond offerings that could illuminate somewhat of the situation. Different kind of just storytelling ideas where you have to get creative and pick out little pieces that whatever is possible you can find. Next slide, please. So a few more ideas. Obviously, you can just build sources and have relationships and ask people to send you stuff, leak you stuff. That's hard to do. And you can also just ask the public information officer, do you have data on this? Some public information officers are truly terrible, and really, I've dealt with really ones that just seek to basically put obstacles in the path of journalists, but some of them are really great and former journalists themselves and are really helpful. Scour the website. A lot of government websites, especially federal government websites, now have pages where they are just listing every single data set that they do make public, such as data.cdc.gov, which I've screenshotted here. And there's a lot in there. I mean, and then if you can't find it, or if it's not obvious what all is in there, again, asking the PIO can be helpful. Officials mentioned elsewhere, I found, like, especially in states, they'll have some one-off report from 2017 and it'll say, contact so-and-so if you have more questions, or whatever it is, legislative report. And often that contact person is a great resource for, oh yeah, here's all the other things that our agency did on this issue, blah, blah, blah. FOIA, in this pandemic, especially just because of the urgency of the issues, I have put in a lot of FOIAs that have just not been returned yet. I mean, it's still waiting on FOIAs I put in April. So for data sets especially, this is not my go-to at the moment, although it is a great resource for other journalism, getting correspondence, that kind of thing. But it is an option. You can always FOIA a data set, or also we've done at CPI, actually entered a data use agreement with a state if a data set isn't covered under their FOIA law, which in this case, we had to pay a couple $100s and write an agreement that we would, give them our firstborn child if we did anything wrong with it, but it was worth it because we got to see some data that no one else had. Also, just think about third-party sources. COVID Tracking Project obviously has a lot of great data right now. Publicaccountability.org is a really cool site where you can just put in someone's name or address and see if it shows up in public data sets. And dataportals.org is another just comprehensive list of some free publicly available data sets. American Hospital Directory is an example of, there are a lot of places like this, but an example of a for-profit company that takes public data and kind of repackages it and makes it nicer and then sells it to clients. And so often they will also just let journalists use it for free if you ask them, or if you have maybe like a nonprofit use. I'm not sure about that, but so that's been helpful, especially for things that are hard to clean up yourself. If there's already a third party that's done that, that's great. Next slide, please. So once you have this data, talk to the agency spokesperson or the PIO or whoever it is that your liaison is, and just make sure you totally understand it. I mean, I think this is basic data work, but just, who collected the data and how is it being used? How complete is it? How often is it updated? Can I have the data dictionary? Just like kind of just reminders to your P's and Q's with data. You can't just, get it and then go. Next slide, please. So just some tips and tricks from my own reporting, especially with the last year. I found that like I've gotten a few things sent to me that it's been unclear who would really know more about this and be a good source to talk to about the information that was contained in it. And so a couple times this has actually worked out for me, which is great, but I've checked just the document information, and there's been an author or a modified by user, and I've contacted those people and they've been really helpful, even if they can't speak on the record, but just on background, helping me know the scope of the document I'm looking at, the data I'm looking at, and what it is supposed to be used for, what kind of decision making is being influenced by it. So that's something I always do. Ask multiple officials, agencies, jurisdictions. So when I collected all of those state profile reports, so a lot of the governor's offices, some of them were helpful, a lot of them just were not helpful. But as time went on, their distribution list was growing. And so I was able to also get them from health agencies and emergency managers and other people within the state, as well as sources at the federal level occasionally. So I personally just mail merged everyone every week and everyone got really sick of that, I'm sure. But, make sure you think about other avenues, like who else would have this. Always read the data notes or the data dictionary. They can help you with shortcomings in the data and also give you story ideas. And then if you do go the route of FOIAing for data, I'm preaching to myself as well, because this is really annoying to me, but keep track of your FOIAs and then poke the FOIA people every so often, because I've had, especially at the state level, people just breeze by their legal deadlines for getting back to me. And, things will go along much faster if you show that you're on top of it and you're wanting them to be on top of it too. Next slide, please. Okay, so I want to talk more about these community profile reports. Just make sure I'm not going over my time. Because they're a really great resource that are now public. They're at that link. You'll see at that link there's PDFs, but if you scroll down, there's also Excel spreadsheets. And I put another link on the slide there. I did a little walkthrough on Twitter if you want kind of a more comprehensive tour of the data there. But I think they're really great for local reporting because they break it down. Next slide, please. They break down all kinds of different metrics by state, county, CBSA, which is basically metro area. And they let you compare across states too, which is great for local reporters. So they can say, hey, like we're the worst here, or we're the best here. And it has all kinds of different testing data, vaccination data, some of which is available on the state level, in different states can be hard to find. But then just also the standardized across states so that you can compare, I think is a really helpful tool. And then it also provides what the federal government has some categories that the federal government has been using to make decisions. So whether areas are sustained hotspots, for instance, and then obviously you can see those like red and orange and green categories. So those are important for kind of, as you cover the federal response to the coronavirus, like is the federal government giving appropriate resources to my area, even, based on its performance. So highly recommend digging through that. Next slide. Oh, and just the data notes on that are really helpful on the very first sheet of the spreadsheet. It has some like updated notes that'll say like Tennessee didn't report anything to us this week, so don't use that or whatever. But there's also story ideas in there, like that you can kind of get through looking at, okay, why is the test turnaround so bad in my area, and what does exactly that mean? So just make sure to read the data notes. And then last slide, a few more resources that I have found helpful in the last few months. And then also a plug for investigative reporters and editors, which is always a fantastic resource. They have so many tip sheets, well worth your membership fee. I love IRE. So thanks so much. Excited to hear the other panelists.
Thank you. I will also plug the community profile reports. Like, they are so nice. The standardization of that data is just incredible. Like, the fact that they gave us county level data, CBSA data, is just something that was not available in the US before those reports were released. And a couple of people from the HHS actually did a webinar specifically on those reports a few weeks ago. Which kind of gets more into the nitty-gritty details. I don't have the link handy right now, but I'll put it in the doc when I send out information about this stuff. Cool. And then next up we have Erica.
Hey everyone. So my name is Erica Hensley. I am a health and data reporter in Jackson, Mississippi. I'm an independent journalist right now. I worked for Mississippi Today, a nonprofit here in Jackson, for the past 3 years, most of the pandemic. A similar situation to Liz. We had not dedicated coverage to the pandemic until March, like most outlets. And we had a sort of quick conversation that was who is uniquely qualified to cover this and who can start looking at data. I happen to have a master's in health and medical journalism, so it got funneled to me, which I think one of the more interesting experiences from this pandemic has been working in a newsroom with other journalists and getting them to think about how the pandemic applies to their beat. As a local reporter, of course, we've got a criminal justice reporter, education reporter, poverty reporter in Mississippi Today's newsroom. So a big part of my job early on top of collecting the data and talking to the agencies, was helping the newsroom understand, how this applies to other local beats. And a lot of that meant getting other reporters comfortable with just kind of basic level data that they were being asked to look at for the first time ever, stuff like positivity rates and case incidents. So I sort of think it's important for health and data reporters to be very conversational with our other fellow reporters and like help them understand what those terms mean, instead of just, using them in our own reporting or explaining to our readers. We also need to help other reporters who've never been on the health beat before. And of course, we are all on the health beat right now, whether we want to be or not. And I think I'd like to focus my portion here on how local journalists can work with agencies, because it's a little different if you're coming from a national outlet. Of course, like, you still have to work with these agencies, but you don't have quite the direct day-to-day relationship with them that a lot of us local reporters do. So there does have to be a bit more relationship building. I think over the summer I had maybe 6 separate data requests out, some for C-section data, some for lead exposure data in kids, and then a handful for COVID. And I really had to work with the agencies to get them to understand, A, exactly what I was looking for, B, why they should help me get this data or publish it themselves instead of me coming to them requesting it over and over. And just like earn that trust with them about what I was going to do with it. Of course, we're not beholden to tell the sources what we're going to do with it. They have to release it. but you sort of have to pick your battles here. I needed a bunch of different data from them. They're a under-resourced agency, that was strapped for time to even address my request. So a lot of it had to do with just kind of having those conversations about why I want it. Again, that's not our job, but I found having those conversations to be pretty helpful. Because at the end of the day, like, this is a very different experience that we're going through with the pandemic. Like, it's not journalist versus agency. We all have the same goal of informing the public. So I really kind of found that what I could do was work with them and pick up the pieces that they weren't able to do and show them what I could do with the data. The example here of this map is before the state was publishing incidents, like a weekly snapshot of what was happening, they were only publishing total cases. And of course, that was helpful for a couple of weeks, but then it became, we were just looking at a heat map of where population was where cases were. So what we did with our map was we just did a quick percent change. We started scraping the data every day, made our own database. Of course, it was all in PDFs back then, so it's a lot of manual labor, but it was worth it to just have, I still have the new cases reported every day in an old Google sheet somewhere. So that helped us to sort of get in front of a percent change map, which of course now we see all over the place, just incidence maps. But it was really important to help Mississippians figure out, where the spread was happening most strongly, especially when it was in random areas at first. It didn't really follow population down here and in other rural areas right away. So that was a really good resource. And two, it helped the state realize what we were trying to do. I wasn't just bashing them over the head with records requests for no reason. I was at Mississippi Today, we offered something that the state wasn't. So eventually they saw us as a resource as well. And also this is kind of example of where I figured out early on how to pick my battles. The percent change I could do myself and identify hotspots. Positivity rate was also something they were not publishing, but that I could do myself if I was just pretty scrupulous about collecting number of tests per week, number of positives per week. Again, a lot of work just scraping and cleaning, but once I had that database built, it was worth it. And we could publish our own positivity rate rather than bothering them about why they weren't releasing it. And that freed up some time and energy on their end to fill FOIAs that I did need answered, which were the names of long-term care facilities that had outbreaks, the names of schools that had outbreaks. The state was releasing those by county, which of course just shields any county that has more than one long-term care or more than one school, which is most, not all in Mississippi. So there was some kind of reverse engineering there on just naming schools because they were the only ones in that county. But that helped, by me doing the annoying, frustrating data work on one side, cleared up FOIA time for them on stuff that I could not do myself that I really did need, their data on. Next slide. And this is just the positivity rate that we published. And it was back in May when we started this, when folks were not really talking about positivity rate yet. Johns Hopkins had started publishing it. That was really helpful. And also, shout out to Liz, I was really relying on those White House task force reports she was collecting. I don't think any from Mississippi had been collected yet. And I was, of course, asking the governor's office for it too, but there was a real tight lid on them. But by collecting our own and then leveraging what Liz was collecting, showing what the White House, what kind of data the White House was giving states, I basically had two data points I could sort of converge and go back to the governor's office and the State Department of Health and say, we know this is being collected and given to you. This is my estimate based on the number of tests and the number of positives y'all are releasing. Probably the timing is a little off. So I need y'all's expertise to tell me exactly what the positivity rate is right now, because I know you have it based on all of these great reports that Liz had collected. So that was an example of kind of using what I had done, just sort of intuitively knowing how to put together a positivity rate, and then what Liz had, published and showing the state, hey, this is out there. I know you have it, and leaning on them a little bit that way. And it's a good resource for readers. Again, it was a really good resource for the state. The state still doesn't publish a positivity rate. They do some by county, but the state health officer came to me and said, I really like what you're doing with the positivity rate. I'm going to start sending people to, to this data page instead of ours if they're looking for positivity rate, because we don't have the resources to make an extra set of charts about it right now, which was very candid. You know, I appreciated that. I was glad ours was a resource, but it's still just about kind of building up that trust at the end of the day, that he trusts what we're doing and getting readers the resource. Next slide. So this was an example of just kind of encouraging good viz. This was what the state was publishing for a really long time. It's not interactive. There's no portal. It's a static, basically population map that is cases as well. But there was no sense of incidence. There was no sense of 7-day average. This was the resource the state was giving Mississippians to know their risk, which is not helpful. So I tried to use, again, our map to show what they could be doing. And eventually they changed to this, like literally months later. But they did do the 7-day average, and they did show a map based on incidence rather than just total cases, which of course is much more helpful. Next slide. And a lot of this, of course, is just like knowing what your state or what your local area does and does not tend to report. For whatever reason here, and a couple of reporters have tried to dig into this a little, Mississippi just does not want to publish, or historically has not wanted to publish a lot about long-term care. So that was something I really wanted to focus on early on, and I have throughout, because of course it's just like our most vulnerable folks, and they don't have any other options. They can't just stay at home. They're stuck in this facility. So I had a really hard time getting data at first. Again, we had to do public records requests for the names of facilities. We still weren't getting a lot of helpful case information there. Then the feds started publishing it, so that's a different situation. But over the early fall, CMS started publishing the names of facilities that were doing this training they had issued. CMS was having a hard time at first identifying why certain facilities were not able to control outbreaks. Then they did some like very specific small sample studies of a couple big outbreaks and found it was literally that they didn't have good infection control, which of course seems sort of intuitive, but that had not really been officially stated or found up to that point. So CMS Medicare offered these new trainings. No one wanted to take it. Probably because they have a lot going on in the facilities, probably because some thought we know how to control infections, but for whatever reason, a bunch were not taking on the training. So when CMS published this, they published the names of the facilities that were doing the training. Next slide. And once I got that list, I sort of tried to backtrack a little bit. And since the state didn't have good COVID data or good long-term care COVID data, I went where I knew did, which was ProPublica. They have a really great infection control or infection citation database where you can search by facility. Next slide. And the feds, CMS, does have a pretty robust database of weekly updated cases, deaths, also cases among employees. So what I did, next slide, is I got the kind of terrible PDF that CMS released about the names of facilities that had done the training. I went back to my original databases of you know, all of the facilities in Mississippi, which I built early on knowing I would need it. And I basically overlaid this, some of ProPublica's data and some of CMS's case data to basically figure out, next slide, which nursing homes, to basically publish which nursing homes had done the training and then reverse kind of report. I didn't name the ones that had not because it was a lot of them and that would have required a lot of like outreach to each facility. But I did go through and find, next slide, the rate of case and death, and also previous citations for infection control. So I basically, like, knowing the state did not have this data in any one place. I'd asked for it multiple times and it was just not something they were really collecting or able to collect. I don't want to like say it was intentional. I just combined a bunch of data sources that I knew were collecting it well, overlaid it all in my own database, and had a really well-received article about what was happening in nursing homes, why some, or the fact that some weren't taking the training, the fact that the ones that weren't taking the training had a much higher rate of case incidents, death, and previously infection citations from the ProPublica report. Next slide. And this is just kind of a plug to use that CMS data portal for long-term care. I just really think that long-term care is like a great area for local reporters to dig into. Not a lot do, just because there's a lot of nuance around the data. Of course, when you have sick elderly people, like, it's just a perfect storm for coronavirus spread, but there's so much more to it than that. And CMS gives us, like, this silly bar chart here, changes every week, and it's just a really quick way to eyeball where new spread is happening. For a while, Mississippi was at the top. We've sort of gotten a little bit better, I think like 6 or 7 now. But it's just, if you're in need of coronavirus stories, which I don't think any of us are, but if you just had wanted to dig into long-term care specifically, this is a really good resource. And you can download the data, just clean for your state. And there's a data dictionary as well, as Liz was talking about, that's pretty straightforward to understand, even if you don't have a lot of data cleaning experience. Next slide. And just a couple of tools that I find really helpful. One is turning PDFs into data, which again, Mississippi still does not have like an interactive portal where I can go in and download the data to actual data like Excel. So everything is coming in PDFs, and it just was a battle that I stopped fighting early on and just devoted the time to convert myself. The free online OCR is a really good tool. It looks very lo-fi, but it will often do better than Adobe for me as far as converting a PDF to actual data that then you can get in and analyze and make how you want it. And then if you aren't familiar or don't have access to Tableau or other sort of more fancy data viz tools, I really recommend Data Wrapper. It's super easy to figure out, to load in your data from either Sheets or Excel, and you can just make something kind of basic like this pie chart here. For a while, Mississippi is a very Black state. So we had a lot of cases among African Americans, of course, at first when we were seeing those disparities, but even going into the pandemic, when the disparities started to even out a little bit, a lot of reporters started to talk about, you know, white folks are driving the case. There's more cases among white folks. But what they weren't looking into was still the distribution of population. Like, it was still a disproportionate effect on African Americans here, particularly Black women, which is something we're looking into now. So just a reminder to always look at percent population versus percent cases, so you can kind of check that divide there. Because even though the disparities have lessened, they're still pretty stark. So yeah, that's all I have. It's a little all over the place, but I think the key is just to earn the trust with the health department or whomever it is you're having to go back and forth with. Because you are going to have to work with them. You know, if you really need a piece of data, see if you can go get it somewhere else, like Liz was talking about with those reports. If it's something specific that only they can give you, talk to them about why you want it, talk to them about why it's important that they just publish it. Talk with other local reporters. I have a little, I know, especially with local reporters, they tend to be very competitive, which I don't like, but a lot of us have sort of gotten over that here this year, and we just have sort of a pool of requests that we've worked on, so we know what each other is asking for. So if the health department says, you know, we can't publish that, I can say, well, I know 3 other people have requested it, so wouldn't it make more sense to just publish it for us so we don't have to keep inundating y'all with these requests? So that's just a plug to be as collaborative as possible with your local reporters, because the goal is to get the public the information they need.
Thank you. I will also definitely second the need to focus on long-term care facilities. I know I volunteer at the COVID tracking project, and that is something that the project is focused on a lot. There's actually a facility map that was released a few weeks ago that I just put the link in the chat. So you might want to check that out and sort of see what it looks like in your area if you do reporting. And then last up, we have Tom, who's going to talk about Marshall Project's work.
Hi, thank you. First of all, this is amazing. I'm just thinking a year ago, if you had told me that I'd be presenting about healthcare data, I would have laughed. I knew nothing about any of this. It's remarkable what we've all been able to do and sort of collect and provide this really important information in this crisis. I'm really psyched to be part of the conversation today. So I'm Tom Meagher. I'm a senior editor at the Marshall Project. We're a criminal justice focused nonprofit newsroom. We also cover immigration policy as well. And for the last year, myself and my colleagues have been creating a database of coronavirus cases in prisons in America. And we're collecting this data every week, and we're publishing it for readers and for other data users. And in the course of that, we've had to develop relationships with a lot of public agencies, many of which we hadn't dealt with that much previously. And they've run the gamut from pretty friendly to extremely contentious. So we've learned quite a few things along the way that I want to talk a little bit about here. If you could go to the next one. This is sort of where we've ended up, but I want to talk about how we got here and some of the hurdles we had to breach. A few days into March, like many other offices and workplaces around the country, our newsroom went into COVID lockdown. We all began working from home. But one of the first things we thought of, because we were focused on the justice system, is that prisons, being congregate living facilities, were going to be seriously affected by this pandemic. And we wanted to watch, and we mostly wanted to see what was going to happen and how this virus was going to affect the people who live and work in our prisons. We knew from our reporting that social distancing and PPEs essentially don't exist there, and it makes everyone vulnerable. But the first problem that we ran into was that the data we wanted just really didn't exist. And so we had to build a system from scratch to capture this data with brute force. We had to find ways to engage and negotiate with many different public agencies to try to get the information that we needed. And so we ended up sort of becoming data creators as well as data interpreters and sharers. So first we had to talk to the people who run these prison systems in all 50 states and to the Federal Bureau of Prisons. This was not trivial because there are a lot of them and we're a small newsroom. And also that some of them, Nebraska comes to mind, won't talk to us. So we divvied up all of the states and prison systems among our reporters. First, we just sort of recruited everybody in our newsroom, and later we partnered with the Associated Press to help with this. When we started in the middle of March of last year, basically no prison systems were publishing any information about coronavirus in their facilities. For the first 3 weeks or so, it was mostly an experiment to see if this was going to be possible. We called every system, we asked a series of questions. We're just trying to collect whatever data we could get without plans to publish it immediately in case it turned out to be a total fool's errand. But we began by making a lot of phone calls. The next slide, please. We made lots and lots and lots of phone calls. Our job as investigative journalists, when you boil it down to the most basic, is that we need to convince people to tell us things that they don't want to tell us. So we had to go to a lot of these agencies, which when we had reported on them, were not always thrilled by the results. Prisons, by their very physical design, are meant to keep both people and information inside. They're not always the most transparent agencies to deal with. But we had to find ways to work with them. And so we started by every week we would go to the agency with the exact same set of very carefully worded set of questions. How many people had been tested for coronavirus, how many had tested positive, and how many had died? And we wanted to get these figures both for the people who were incarcerated there, as well as the people who work in and operate the prisons. And we made sure that all of our contributors were asking the same questions, and we were putting our answers into a shared Google sheet, so that we could use that to draw upon for our analysis. And because this data was being collected by hand and input by hand, it's all right. I like the green phone. I think it's kind of cool. It required a lot of work to vet this data, primarily by myself and my colleague, Katie Park. Because we had to ensure that the numbers coming in made sense, and that there weren't typos inadvertently flipping numbers, slipping in. Very few of the departments we found could or would answer all of our questions. Many of them, for instance, weren't counting how many people they were testing. They only had how many people, or how many tests were being conducted in total. So every week we take what we could get, and but we made sure to be clear, we're coming back again next Tuesday. We're going to come back and ask the same questions over and over. We wanted to make sure that they understood that this was a routine, and that by ignoring us, we weren't going to go away. Which we had found, in some departments, when they're dealing with a news organization in particular that they're not familiar with, the first reaction is to, well, we'll see if they come back for it. They're not going to necessarily be proactive about it. So we wanted to make that clear. And when something didn't make sense, when they gave us numbers that were sort of out of the realm of possibility, or they went backwards, we'd call them up and ask them to explain what was going on. Within a month or so, prisons started to set up rudimentary web pages. I mean, very rudimentary. Some of them were sort of circa 1990s web designs. Some of them were pictures. The better ones were PDFs, and a handful had actual clickable, downloadable data. And in some ways, this was an improvement because it allowed us to gather more of the data more quickly. But again, very few of them, next to none of them, were putting everything we wanted to know online. So we still had to call. We still, to this day, I'm doing it right before I came on here, we're calling and emailing these agencies to ask them to fill in the gaps. Keeping track of all these websites can be kind of tricky, and knowing when they were updating is tough. And so now you can go to the next slide. So we used a tool called Klaxon. This is a free and open source tool that we built in our newsroom several years ago to notify us when web pages change. So I was able to take more than 50 websites and put them into Klaxon in about 15 minutes. And what happens is Klaxon sends us an email and Slack alerts every time the web page changes, which is great because it alerts me to know, okay, how frequently are they adding information to their site? And it also, in the process, creates a archive of screenshots. So I can go back over time, and I can see every time Iowa's webpage since the middle of April. I have every single change that they've made. If we need to backtrack or see what went awry with the data, and because Klaxon also highlights for us exactly what changes on a page, we were able to catch some of the state's prison systems being a little squirrely. So if you go to the next slide. So in this instance, we saw that Texas's Department of Criminal Justice, TDCJ, which in many ways is quite transparent in this respect. They post the names of people who died identified with COVID related causes, but they quietly took 7 people's names off of the list without any notice until we called them up on it. It was like, what happened to these people that died months ago? So this was in November. A bunch of these deaths were for May, June, July. Why are you pulling numbers back? And initially there was some finger pointing and blaming other agencies, their healthcare provider, the state health department. Ultimately, they put some of the names back. Others they said had been misclassified in the first place. Klaxon was a tool that let us see very granularly what was happening there, so we can keep an eye on how data is changing. Okay, so the next slide, please. So to collect this data every week, we've recruited dozens of reporters and editors between the Marshall Project and the Associated Press to help. But to do that, we have to give them the tools and the support to ensure that the data that they're bringing in to us is going to be good. One of our colleagues wrote a memo on everything we need to know about every prison system we're dealing with. What data they report, how they define terms, when they change how they define terms, who we should contact there with questions. We refer to this sort of canonical memo every week in our data collection, and when somebody new comes in the project, we share it with them right off the bat. And we try to be as clear as possible with our contributors on exactly what kind of questions to ask. And we'll talk more about why in a minute here. But that requires a ton of emails. And I think Liz mentioned earlier mail merge. You go to this one. So this is a tool because we're sort of collaboratively creating data mostly through Google Docs and Google Sheets. We found this script that would let us use a Google spreadsheet to send emails out through Gmail. So we have one spreadsheet where everybody puts their data every week. We run some R scripts to pull the data down and do some analysis and checking of it. And that spits out, here's all the remaining open questions for each reporter at this stage of the week. I can take that and put it into what's basically this spreadsheet here on the slide. And that will automate emails to 20 reporters. Because for the first month or so, I was writing them by hand, and that was not sustainable. But this is a great tool. This is, as it sounds, very tedious work, and it can be wearying for our colleagues to help with this, particularly because some of the nonsense we have to deal with some of these agencies can be very dispiriting. So we try to cycle people in and out of the project as much as we can. And give them a break. So these prison systems aren't, like I said, many of them are not known for their transparency when there isn't a global pandemic, but it can be a little bit more stressful these days. So if you go to the next slide, please. So I want to talk a little bit about some of the hurdles we've dealt with specifically in the data that's come into us. As I said, a lot of our workflow is built around basically visiting 51 web pages and transcribing what's in there. Why don't we scrape them? Why don't we write programs to pull that down? We've thought about that. I mean, myself and my colleagues and my team were all programmers, in addition to data journalists and analysts. But it just doesn't make sense for this kind of project because scrapers want structure and predictability, and those are two qualities that do not exist in this data. As many of these prison systems like us are sort of getting to know and understand what's happening with this pandemic, things are constantly changing. If you can go to the next slide. What we found is that not every state will report their numbers the same way. Many of them change the parameters on a very regular basis. Sometimes they're changing definitions. We've seen some where they say, this happens pretty regularly, actually. We just caught another instance of it this week. At some point, they were reporting how many people they tested, and then later they decided they were changing their metric to how many tests they were performing, but they were using the same label in the column and not indicating to end users that their metric was changing. And at a certain point, you're like, how are you doing 40,000 tests in a prison system with 5,000 people? So we have to be constantly vigilant about that. Sometimes what's happening is the information that's provided is changing. This used to be what Florida would provide. We couldn't even fit the whole screenshot into one slide. But if you go to the next one, you'll see that this is now Florida's Department of Corrections COVID data. They're no longer, they never gave any information about who was dying in their prisons, but they're no longer giving facility by facility information. They've really rolled it back. So we didn't want to waste a lot of time building really smartly developed and engineered scrapers when things were going to go sideways pretty frequently. If you go to the next slide, this was the entirety of Missouri's Department of Corrections COVID dashboard for about a week and a half as they were changing. They initially had a picture-based dashboard. They changed it to, I don't want to malign any company because I can't remember which one it is, but one of these companies with these Java-driven dashboards that are very difficult to use. or understand, and that crashed, I guess. So now they've gone back to their picture-based method, which honestly is we've got to type it all out by hand anyway, so it's fine. But this is not as uncommon as you would expect. In each of these instances, we have to go back painstakingly to each agency and one by one sort out the discrepancies. It's really slow and time consuming. Some of them, to their credit, are quite responsive and want to help. And will work with us to figure out what's going on, where things went awry, and the changes. To be fair, again, they knew nothing about this at the beginning. They were not prepared, as I wasn't, many of us weren't, for any of this. So they're creating systems on the fly, and often the people that we're dealing with have next to nothing to do with the frontline operations of either treating or counting the people who are sick in their facilities. The PIOs are sort of reporters within their agencies. They've got to go out and seek out the information, which in some of the larger prison systems is very difficult to do. So, I think many of them are definitely making a good faith effort to try to help with this. We get all this data in this very laborious, and hopefully I'm not going too far over here, but let me know. I can skip ahead a little bit. This very laborious manual method. We still use a lot of automation in our system. We have a series of programs that we've written that takes the data out of our Google spreadsheet and basically checks everything. Flag anything that looks weird, needs more investigation. These scripts are saying, this happens every single week, but it still strikes us. When we built this system, is built on the assumption that cases can either stay flat or go up. But almost every week we find that some state has cases and test numbers dropping what they're reporting, which still boggles the mind. So every time we have to go back to them and get an explanation. Very often it's their systems are sloppy, frankly, because they're creating them on the fly. And they'll go back and do audits and say, oh, actually, we were counting the same person 5 times. And they'll go back and try to tidy that up. And then we have to go back to our data and adjust because usually they aren't able to give us historically accurate numbers. So we'll make estimates, and we'll be clear about that with our users and our readers when we have to estimate based on revisions from the state. If we've learned anything from all of this, it's that there's a lot of different ways that data can go wrong. Like I said, the numbers the amount that it goes down is astounding. Also, into what I mentioned earlier, we want to be very clear about the questions we're asking, because we find even from very well-intentioned and helpful public servants in these agencies, weird misunderstandings happen. We have to calculate rates of infection and death rates. We collect the population of every prison system, both of the prisoners and the employees. We asked every system how many employees did they have as of a certain date. North Dakota gave us a number. Months later, they came back to us and said, oh, what we gave you was not the number of employees we had, but the number of people who were working on that day, which was a Sunday. So it was about a quarter of the actual employment of the agency. And so it's really important to be clear with them and also to go back and verify when things look strange. And if you'll go to the next one, we'll sprint through a little bit of this. Yeah, so really what we want to ultimately, as I think Erica and Liz were saying, is like our goal is to inform people, to give both the people in the facilities, their families, and people in the communities that are paying for this insight into what's happening. Prisons and jails, in addition to nursing homes, are among the biggest drivers of community spread. And so we want to be clear and upfront about this. Aaron Kassane at the COVID Tracking Project had this great tweet about how, in many cases, it's impossible to know exactly to the decimal point how many cases are happening because the systems are so fragile and new for counting this. And so we try to be clear with our users. We have footnotes for every state on our webpage explaining when data is missing, data is obfuscated, or when we've had to estimate it and revise it over time because of changes from what's been reported. You know, something else we found that's really interesting is that we have gotten a little bit of buy-in over time from agencies because this doesn't exist anywhere. The Bureau of Justice Statistics has put out a alert that they're going to start trying to count this data next month. So it might come out in some version in a year or two. But the agencies themselves are very, very eager to see how they're doing compared to other states. And so we've heard many anecdotes and some directly from corrections commissioners saying, I'm looking at your website and trying to see how we compare to this state or that state. They also are using it in public statements, sometimes erroneously, to try to make themselves look better. And we've had to go to them sometimes directly, sometimes on social media to say when they're misinterpreting or misrepresenting how they fit in the data. But ultimately it does help because some of those commissioners are eager for us to get better information so that they feel like they will compare better to their peers. If you go to the next one, I think there's just two more quick slides here. One thing we've also had to keep in mind is that we're operating on 2 cycles as journalists. Every week we're creating this data, we're finding it, vetting it, and publishing it. We put it up on GitHub and data.world for all of you to use. But we also need to take time to step back on a sort of longer cycle and stick our heads up and assess what the data is telling us and to tell the stories that the data enables us to get insight into. And sometimes that is simply the data is terrible and we don't know how people of color are being disproportionately affected in many states because they're not collecting that information and no prisons are looking at it. Other times it's to just really sort of look at some of the practices and habits of prison systems that are leading to unnecessary and excessive spread of coronavirus. So it's a little difficult to juggle 2 timetables at a time, but we found that's really important. And then the last thing I'll say is, if you go to the last one, is just that our data is free and online. And if you go to the last slide, it should have the URL for anybody. Yes, that tiny URL, you can go there and download it for yourself. And it has every week since March, the number of cases in every prison system in the country. All right, thanks.
Thank you. I definitely relate to a lot of the challenges you talked about with like terrible state websites that change every week. Definitely similar stuff to what we've dealt with at the COVID tracking project. And that need to sort of do everything manually and look out for the changes. Sweet. So we have about 15 minutes to do questions. I know there was one a bit earlier that Liz, you answered a bit in the chat, but do you want to talk about it more? The question was if folks have any tips for asking agencies to run queries on data. If it's something that you expect that your state has, but they haven't maybe provided it publicly.
I can talk more about it if wanted. Can you hear me?
Yep, go for it.
Yeah, so I mean, it depends on who you're working with and how knowledgeable they are at the agency and how helpful they are. You know, obviously they can do it if they have time to, and if it's, you know, part of their job, but they often won't. And they're not required to under the law. Like if you FOIA'd for something and asked them to group it by something, they would say, we don't have to create a new record for you. But you can go about it a couple ways. You can say, you know, look, I know you have this data and this is the answer that I need out of it. So I could get the raw data, you could just hand it to me and I can find the answer. Or if, you know, you're not going to do that, here's how you could go about getting the answer from it and you could give me the answer. Like you could kind of walk them through the options of, you know, which one sounds less time consuming to you. Like, I think the answer for them is, okay, I'm just going to hand you the data. So I would just kind of talk through what you need, what you want, and say, like, let's work together and getting me this answer. a lot of, especially when you're dealing with just like the front agency people, like news people who interact with news media, you know, they don't necessarily have data experience. So the minute you say query, they kind of get scared. But you can ask, hey, like, could I talk to, you know, your data guy or your data visualization guy and see what he thinks about like how easy this would be to do. You can always ask to talk to other people as well.
And I would just add, the same as Liz was just saying, just ask them how it's stored. Oftentimes, you know, we were working with a very old epidemiology data storing and tracking database here that was upgraded halfway through the pandemic. But talking to like the second or third person I could get in touch with that the front desk PIO finally was willing to put me in touch with, once I agreed to not quote them from this conversation, which I didn't want to do, but I just asked, how was it stored? And that helped me understand literally what columns they were looking at. So I sort of could reframe what I was looking for. And not just with COVID, like I've done that with a lot of reproductive health data as well, looking at C-sections, like it's collected so differently across the US, starting to be more standardized, but just asking them like, what are you literally looking at? And that can sort of frame how I can readjust this request to make it make sense to you.
We've also had luck with a lot of these agencies have to generate certain annual reports and statistics for their legislative oversight bodies. So sometimes if you dig into those reports and find who is it that is actually writing them and contacting them, when you find the data geek in the bowels of some agency, they're usually really excited to talk shop with you about like how their database works and what they're collecting. And sometimes you can make contact with them and then go through the PIO, and I'll invite the PIO to sit in. Like, sure, you can be part of the conversation. It might be boring, but let me sit down and talk with them so they can give us a sense of what's possible. But yeah, to Liz's point, like they don't have to, and many of them don't want to do it. So you really have to find ways to build personal relationships with some of these folks to make them want to do it.
Another question we got that I think is for Tom is your team considering interns for the project before your summer internship cycle?
Not right now, but you should get in touch anyway, because there's always things that come up unexpectedly.
Nice. I'm not seeing more questions in the chat, but I'll ask one, which I'm curious about is, could you all give an example of when you sort of had a data provider give you a hard time and how you navigated that?
I can give you a million examples, but I'll give you a couple quick ones. Sometimes it's a matter of finding a different person to approach them because our project is so collaborative. It could be one reporter is just butting her head against the wall trying to deal with a certain PIO, and it could be, you know, if we have somebody else try it and almost sort of like good cop, bad cop it, sometimes that can help. We've also had a little bit of luck with the one state I'm still surprised is has been so difficult, Nebraska, who've literally ignored hundreds of emails and phone calls or hung up on us when we call them, is finding whoever is who is the oversight body, if there is one for the agency. And sometimes there's a legislator, or sometimes there's an ombudsperson or inspector general, and sometimes we'll go through them and they can help clear hurdles, or they might be collecting the data we're already looking for. And that's worked in a couple of instances.
I would just say that Mississippi is like, you know, gets a bad rap for being last in everything, you know, and there's certainly reasons for that, mostly historical. But it's part of the reason I came here and why I want to report here and why it's important for me to be here, especially for, you know, folks that care about social justice issues and disparities. Like, you have to go where they are, and they are here. All that to say, I feel like we were a little bit behind at the beginning in collecting and publishing data, but the state health department like really did work with reporters to an extent to like figure out what would be most helpful for us once they realized we were on the side of getting accurate information out to the public, that we could help them. So they did sort of conform with what they were publishing, helped us to do our job better, which inevitably made their job better. So not thinking about COVID specifically, but there are a lot of instances, again, with that C-section data that I'm working on, where I was just, for lack of a better word, very mansplained to about what the definitions of certain C-sections were. Having the Joint Commission, national evidence-based medical definitions in my hand, going to him, telling him what I was looking for. And he was, telling me that this data was not collected this way and could not be queried this way. I knew it had been because a researcher who I approached first had already requested it from them. So I was just getting a lot of back and forth. And this was the guy, like I had gotten through the PIOs to the person in control of the data, just telling me that certain definitions I was looking for were repetitive and didn't make sense methodology wise. I knew it was wrong. So it was just standing my ground, being kind, very persistent, linking national medical evidence-based data where I could. And eventually I got it, but it took a really long time. And if I would have given up, I wouldn't have got it. And, so that's a reason to be persistent, like everyone else has said.
Yeah, I just say, you catch more flies with honey or whatever the saying is. Like, I try to assume that people are going to be helpful. And then if they're not, then kind of be more pushy to get what I want, show them I'm not going away. But yeah, I would initially just say, hey, like, haven't heard back from you. Like, here are a couple places I think this data could be, or whatever it is, just assuming the best about people. I had some states that didn't get back to me when I was like looking for these reports. And then finally, like New Mexico was like, actually, we haven't been getting them. We don't know where they are, and they were felt embarrassed. They didn't know where these reports were. So that was enlightening for many reasons, because they were supposed to get them from the White House. And I was actually able to help them find them for their state. So, just assuming the best about people at the beginning, and then just trying others, like trying ways to work around people who are being difficult. And I think it's my go-to.
We just have a couple more minutes. Do y'all have any last pieces of advice or last resources that you'd want to share?
I would just encourage, I'm not sure the data literacy of everyone on the webinar, but you can teach yourself a lot of this stuff. I mean, I did. It started from a grad school class about data viz 5 years ago. And before that, my data reporting was very basic. But you can teach yourself a lot of stuff, even if you don't get to the coding level. And IRE and NICAR have a ton of tips and tricks that will help you get there. And it's such a community that they'll help you too. Things I haven't been able to do, I can get in touch with someone, and sometimes they will just help me get over the line, or they'll do it for me if I'm on a deadline. And I'm not saying they'll do that for you, but you can really teach yourself a lot of this data reporting or data analysis if you don't have that skill set. And there's a big community out there that will help you if you have specific questions.
I would say just one more plug for the COVID tracking project. They're winding down their data collection, and so they're trying to kind of outsource all the stuff they've learned. And they're having some webinars for journalists walking through big data sets that the federal government has made available and how they compare to COVID tracking project data sets. And then also, thinking through the future of data and the pandemic, like pandemic data has gotten so much better. But there are a lot of spots that we're still like flying blind, like long COVID, people suffering from symptoms weeks later, things like that. So starting to think about, I think, your local health departments and states, and ask them if they're thinking about how to collect that data and how to go about that and what it means to be recovered from coronavirus. And kind of, I think that's kind of the next frontier in terms of trying to collect, looking at how we get out of the recovery from the pandemic, trying to collect stuff that will help us get insight into how that's going.
And yeah, jumping off of that a little bit, I mean, I think some of the federal COVID data, pandemic data is getting better, but certainly in the criminal justice sphere, in some cases, it's getting worse. So I would say I would love to have everybody helping to keep an eye on this. I think particularly in local jails and police departments, there's not as much scrutiny in many places as we'd hope, just because there's so many of them and it's hard to keep track of. So if you have the bandwidth, see what's happening in your local jail and FOIA some data. But I would also put in a plug that both Erica and Liz mentioned for IRE and NICAR. They have their annual conference next week, I think starting a week from today, and it's all virtual this year. So if you go to ire.org, you can sign up, and it's 3 days. It'll be afternoons full of workshops and a lot of data practitioners sharing hard-won lessons. It's a great resource.
Yeah, so I'm just going to share my screen for like 30 more seconds to show the last workshop that we're going to have in this series coming up next week on communicating COVID data. So we're going to have Christy Ashwandin, who's a freelance journalist, Julia Ledur, who is a visual graphics reporter at the Washington Post, and then Ann Choi Mo Welch from the City NYC, which is a local outlet here in New York City where I am, that has done some really cool data reporting work. And that one is going to start at 4:30 ET, actually after the NICAR workshops, because I didn't want to conflict with those, of course. Great org. So yeah, thank you all for coming. You should expect to see the recording and some links and notes and stuff from me later this week. Yeah. Thanks, everyone.
Thank you, guys.
Yeah, thank you. This is great.
Thanks.